So Warren, you asked us to get to the nitty-gritty. I'm not sure that we got to nitty-gritty, but we had a great deal of information shared. Next slide. Next one. Okay. So for those of you who weren't in this session, the framing of it was faculty-run and faculty-assisted student-run clinics are excellent opportunities for health professional students and trainees to learn about unique needs of the special populations while engaged in real and rewarding work, and I think the group affirmed that this statement was true. They provide excellent opportunities for IPE doing real work, and what part of the conversation is that many of these opportunities do not have purposeful IPE yet. And so it might occur, but it might not occur. You may have students of different health professions working together in a building or in a clinic, but not necessarily, but they're all there, but they're not necessarily working together in building team. And so something that we need to work on and to identify are places where purposeful IPE is working in these clinic settings. And we did hear that where it does work, what's important is that the students are reporting it's the only place that they're seeing IPE. When they go out to clinical rotations and other places, they may not be seeing what they may be hearing about it in classroom, but not really seeing it in the real work world. And as we have heard yesterday, today, and other workshops, this requires faculty development. And someone, I think, said it quite nicely. They said faculty of the future need to re-envision their role in a lot of things that we're doing. The next statement that said most of these clinics appear to be a medical student or dental student, we found not to be true. So our little planning committee was a little bit naive in this activity. We heard from nursing, we heard from a variety of other professionals who were in the room. Too numerous to mention them all, but I do want to do a shout out to the one that raised a smile and aha moments for several people. Veterinary medicine as a way to bring patients who care about their pets sometimes more than they care about themselves into this environment. So thinking about vet med in a different way, which then said that perhaps there is greater spread already of these types of clinics, just not scaled up, but perhaps we need to spread to go beyond things like nutrition, IT, OT, nutrition, OT, PT, medical school, but to start including groups like informatics, communication, and so on. So the clinic spread is greater than we expected, probably longer and more sustainable than we expected, but there's work to be done. And so the last point is the session was to draw upon the lessons, and that is what we did, is talk a lot about lessons from very distinct different groups. Again, too numerous to mention here. Next slide. I started out by saying that we had done some review of literature, and there actually is very little in the published literature about this. What we heard is that it's often put into newsletters, that institutions often brag about what their students are doing in these clinics to help the community, but that's as far as it might go. And so there's some onus on us to pay attention to this, and that one of the things that really is there's an opportunity in these activities to do research, to get outcome data, and to move forward, that there are systems that can or should be put in place to do that in the future. One of the places for those of you who are interested, because people said they came to the session for tools and examples, there is one website, the Society of Student-Run Free Clinics, that has a whole listing of clinical opportunities and a wide variety. They're state by state. Somebody did bring out the point that while we call these free clinics, it's no cost to the participants, but there are lots of costs that are part of the problem or part of the issues of sustainability for having these type of clinics. Next slide. And kind of finally, I brought to the table, it's sort of like the false debates we had yesterday. There really aren't two sides. There are really not student-run, faculty-assisted. They're not really faculty or institution-run student-assisted clinics. There's a wide range of these kinds of clinics, and they come with different values. And one of the significant discussions that we had was that it's important to recognize that those clinics that started out more like volunteer, out of altruism, to helping the needs of the community, to be safety nets for the community, that those have evolved, and now we're talking about or thinking about having them actually have an educational role in addition to the altruistic role. And so how do you keep, and I think the phrase I heard several times was, how do you keep the specialness of the activity for the students that they've gotten when they've been in volunteer clinics, as you build those or structure them in a way that there is institutional support so they keep going, and can be sustainable, and faculty can be rewarded or assigned to helping in these areas. And not only do you lose the specialness, but someone also said, how do we make sure that we don't lose the space that students have for creativity, to finding solutions to things that if we really do put a big structure around it and worry about all of the accreditation, not to say that those aren't important, but do you then take away space where they have had opportunities to explore, examine, create, and move us all forward? And the last comment is that one of the important things is to call on our academic institution to value this whole range of clinics, to be more than just a nice PR piece, but to put value into those situations. I hope I captured at least a teeny bit of what was said. It was pretty, pretty amazing.
Good. Comments or questions, either first from the group or from the broader group?